Hello, everyone. I'm Dr. Renee Mehrra, and today I'm talking to Vaidya Meenakshi Gupta. Namaste, Meenakshi Gupta.
Namaste, Dr. Renee.
Thank you. Thank you for joining today. Vaidya Meenakshi Gupta has done her master's in Ayurveda from the National Ayurveda Institute in Jaipur, India. She's got over 23 years of clinical experience in Ayurveda. She has an Ayurveda Wellness Center in Plano, Texas, AyurRoots, and she's a prominent speaker and ambassador of Ayurveda in the West. And we're going to be talking today, Vaidya Meenakshi Gupta, on a very critical health issue, which is Madhumeha, diabetes, type 2 diabetes, and because it's globally on the rise, even in the United States, according to the Centers for Disease Control and Prevention, over 130 million people estimated to be diagnosed with diabetes and pre-diabetes conditions. In India is the diabetes capital of the world. So this is a very critical health issue, and we want to go with early intervention so that it doesn't become full-blown and it becomes with comorbidities. So let's talk about the root cause of the hetu of Madhumeha from the Ayurveda perspective.
First of all, thank you, Dr. Renee, for inviting me for the ARC platform. When we talk about the diabetes, yes, you are right. Statistically, if we see that the numbers are increasing day by day, and many people are pre-diabetic, and sometimes they don't know that even they are pre-diabetic, in the situation of the pre-diabetic. So in Ayurveda, which is a 5,000-year-old science, it has been mentioned under the name of Madhumeha, and it is one of the disorder mentioned under the Prameha, which is a 20 type of Prameha has been mentioned in Ayurveda. So when you ask about the hetus of the diabetes, we know that in modern world, it has been said related to the lifestyle disorders. So in Ayurveda also, if we see the first Sanskrit shloka, Asya Sukham, means the comfortable seating. Swapan Sukham means the comfort of sleeping, excessive sleep, lack of physical activity, sedentary lifestyle, and exercise. And Kapha Krutacha Sarvam, all foods and lifestyle activity which increases the kapha. Those things, including the stress, grief, fear, and long-standing chronic health issues, can lead to the diabetes. So if we see that the physical and the mental hetus are mentioned in Ayurveda when it comes to the diabetes. And as I said earlier, the diabetes is related to the 20 types of pramehas which are classified in Ayurveda as per the doshic causative factors. So Vataj prameha, Pittaj prameha, Kapach prameha. So Vataj prameha, these are 4 types. Pittaj prameha, 6 types, and Kapach prameha, there are total 10 types of Kapach prameha.
So all the 3 doshas involved, and what channels are impacted here?
Yes, the urinary system, prameha is related to the urinary system. So for the urinary system, 20 diseases has been mentioned. And out of these, diabetes mellitus is termed as Madhumeha in Ayurveda. And it is one of the 4 Vataj prameha. So it falls under the category of the Vataj prameha. So that's how the diabetes has been mentioned. And another classification is also based upon the body structure. So according to the physical management, Aptarpanjanya describing the lean diabetic, and the Santarpanjanya, which is related to the obese diabetic. So this is the classification. And the third classification also, because of the etiological, like a Sahaj, and because of Apatyanamitaj. Sahaj means which is related to the genetics, hereditary. Apatyanamitaj, which means unwholesome things related to the food, lifestyle, as well as related to the sleep.
So when we're looking from the Ayurveda perspective, the pre-genetic disposition towards diabetes is equally important with lifestyle?
That is true, because if there is a pre-diabetic deposition in the form of genetics, and if the person is not following the correct diet or the lifestyle, then it is a deadly combination. It is a deadly marriage, I always say that. When you have the hereditary history or the genetic history of the diabetes, and if we follow the certain diet and lifestyle, to change, to modify the gene expression, which can happen. And that also helps in the preventative measure regarding the diabetes.
There is a family history of diabetes, but yet you've been able to control it with early intervention and lifestyle management.
Yeah, I would say that not the control, the prevent. So far, I'm in my mid-40s, very strong family history of diabetes, both of parental sides. And so far, because I am a firm believer of Ayurveda, what I preach, I practice in my personal life also. So I follow the diet, lifestyle, do the fasting also, and that is helping me keeping it away from the diabetes so far.
So intermittent fasting is not for all the constitution types, those who are obese, that's great, but those who are very skinny, we talked about that before. For that, it's not recommended in Ayurveda.
Yes, the line of treatment, when we talk about in Ayurveda diabetes, according to Ayurveda, the line of treatment of Prameya or the diabetes is strictly on the individual constitution. And that line of treatment is entirely based upon change in the lifestyle of the person, along with certain Ayurvedic supplements, the diet, and healthy lifestyle. So even the mental aspect of that person, we always say that watch your stress level and de-stress yourself. But when the classification from the clinical aspect, there are two types, Sthalya and Krish. Sthalya means obese, and Krish means the person who is having the diabetes but is lean when it comes to the physical constitution. So in Sthul Pramahi, we say that the Aptarpan Yukt means the fasting, which can be in form of the Shodhana purification process. After giving the purification process, one can go for the Aptarpana, which means reduction in the body weight by the controlling the diet and controlling the carbs, doing the exercise and taking some supplements. And then comes the fasting also, diet control, cleansing therapy, all those can be helpful for the person who is obese. But when it comes to the lean person who is Krish Pramehi, there the fasting is cannot be done because that can create more harmful effect rather than providing the benefits. So that depends upon the we say that the body type along with the weight which treatment needs to be done. One of the important aspect of Ayurveda is prevention, right? So in diabetes, we see that there are some predominantary symptoms which explain if it is a pre-diabetic situation or if the person needs to watch how he can prevent the diabetes. So those symptoms, if we are watchful, which can be helpful in changing the diet, lifestyle, as well as incorporating right amount of exercise. Mm-hmm. So those symptoms are like if somebody is experiencing sweetness in the mouth, or there is a layer of, we say that the tartar in the teeth, malin danta in Ayurveda we say that, or the burning sensation of hands and feet, excessive oily skin, shiny skin, and excessive thirst, which is a predominantary symptom of diabetes, feeling sweetness in the mouth, as I said earlier, excessive urination also, or the urine start becoming, normal urine is always clear. If the urine start becoming turbid, that is also one of the parameter of the pre-diabetic situation. Or if the urine color changes towards the honey color, it is a very, very specific the mentioned in Ayurveda that if the urine color have the specific color of the honey, if the person is started having excessive sweating, body odor also, in spite of not doing the physical exercise, if those things started appearing, that means that is heading towards the pre-diabetic situation. So these are the few things which we can watch and can help in preventing the diabetes in the future if we change our diet and lifestyle.
So it's important to look out for these symptoms, and so early intervention is always the key.
Yes, early intervention is always the key because main goal of Ayurveda is prevention only.
Right. So as you mentioned, lifestyle management, intermittent fasting, depending on what constitution, proper sleep. proper dietary habits, increased physical activity, looking out for the symptoms, and then having the treatment.
Yes, the first treatment is your diet, as you said that, and then second is your lifestyle and the sleep part, and the third is the herbal component. In Ayurveda, there are various Ayurvedic herbs which has been mentioned, especially the herbs which are bitter in nature or astringent in nature. We say that Tikta and Kashaya in the taste, those are the best one to incorporate when it comes to the situation of the pre-diabetic or the diabetic, because those improves the fat and carbohydrate metabolism. And few of them are turmeric, even gugul, haritki, amla, Indian gooseberry, shilajit, all these things can be incorporated. Especially for the person who is obese, overweight, the gugul can be used because the gugul is very, it has the scraping properties, helps with the clinically also it has proved that it helps with the hypocholesteremic.
Are you talking of Trifla Gugulu?
Yes, the Trifla Gugul also is very good combination because it is proven to reduce the cholesterol level, as well as it also helps in the diabetic situation. But there are various single formulations also which one can use, like Guruchi Swarasa, Tinospora cordifolia. The juice of that, the 10 ml twice a day, that also can be taken, and it has been mentioned in the Ashtang Hridayam. Then the Amalki Churna also, which can be taken in the dose of 1/2 to 2 teaspoon twice a day, and that is also being mentioned in the Ashtang Hridayam. Then the Karvallak Phala Churna means the bitter gourd, that also, the dried bitter gourd powder also can be taken along with that. And then there are various compound preparation which can one can take. Various are rasa preparation, which in the United States we don't use, like Chandra Prabhavati, Vasant Puskumaka ras, Vangeshwar ras. Apart from the rasa preparation, Nisha Amalki use and the Trifla Hridra Yog, Trifla Daru Hridra Yog can be very beneficial. Nisha Amalki, combination of turmeric and amla. Daru Hridra, Trifla and turmeric combined together also can be very good. Apart from this, there are various Ghritam preparation, decoction preparation, Avlay preparation also. But all these preparations should be used strictly under the Ayurveda practitioner and by knowing your constitution and what we are dealing with. The name of the medicated ghee, like the Dhanvantara Ghritam, which is mentioned in the Bhaprakasha, Dadi Madhya Ghritam, which is again mentioned in the Bhaprakasha. There are certain avlay, which is a jam preparation, Gokshur Adi avlay, preparation decoction with the Gokshur, Tribulus, that also can be taken. Then there are various decoctions one can make at home also, like Trifla decoction can be combined with the Darvi, Saptaparna, Mustaka. All these herbs has been mentioned in Ayurveda, which can be helpful in the pre-diabetic situation and helps in managing the diabetes also.
Okay. So Gokshura, Shilajit, Trifla Guglu, Mustafa, these are all important herbal supplements, Ayurvedic supplements. Have you prescribed these in your practice to your patients who have diabetes or pre-diabetes condition?
Dr. Renee, I try to go with whatever is easily available in United States. So, and turmeric and amla is very easily available over the counter also. So that I have used in my practice. Then cinnamon also has really good effect. Sometimes I combine that also. Trifla also has very good effect on diabetes. So Guruchi is easily available. So all this, whichever is easily available for the clients, I prefer to use those combinations. Because in Ayurveda, the main thing is it does not regard diabetes mellitus as a disease that can be treated merely with the medicines or the Ayurvedic supplements or the dietary regimen. It is a combination of everything which can be helpful. Right. And it is clearly mentioned in Ayurveda that we cannot treat the Ayurveda. It is not curable. Yapya Vyadhi, we say that, means not totally curable, very difficult to cure. But the prolonged use or the consistent use of your diet, your lifestyle, and some supplements, and following the de-stressing techniques can be helpful, can protect to live a longer life, healthy life, without having the side effects related to the diabetes.
It's better to treat it, even before the pre-diabetic stage, and so that it doesn't create more comorbidities, whether we're talking of kidneys or we're talking of our vision, Alzheimer's. I mean, it can affect so much: brain health, gut health, kidney health. So very, very important to look out for these symptoms. And if there's a predisposition to diabetes, it's important even more to take care of your lifestyle and treat it before it becomes full blown. That's a very important part over here that we're talking about from the Ayurveda perspective, and depends on the severity and intensity of diabetes. So how long should these herbal supplements be taken?
So it depends upon person to person. Again, as I said, the main medicine in Ayurveda, we say that when it comes to the medicine, your diet is the first medicine, your lifestyle is the second medicine, control use of the senses along with the sleep is the third medicine. So when we take these three in the account, then comes the fourth part, which is the herbal supplements. When we say, somebody says that, okay, how long I have to use? If you correct the diet, lifestyle, do the exercise, do the fasting also as per your constitution, and de-stress yourself with the meditation, yoga, walking. 100 steps in Ayurveda has been mentioned after meal, which I would say that more than the 100, 10,000 steps maybe. Outdoor walking is very, very important, because when you do the indoor exercise, we are using the controlled environment. We don't shiver here, especially in the Western world. We don't sweat much because all the exercises also we do indoors. So there is those parameters when we are correcting. Then comes to the herbs, which can be taken according to the constitution for a month or two, and depending upon how the body responds to other aspect, it can be prolonged, it can be tapered it off. But I would definitely suggest, do not do anything without consulting a proper Ayurveda Vaidya or the practitioner.
Thank you very much, Vaidya Meenakshi Gupta, founder director of AyurRoots in Plano, Texas, and serves on the board of AAAPUSA and many other Ayurveda organizations. I'm Dr. Renee Mehrra. Thank you so much for watching.
Thank you so much, Dr. Renee, for inviting me. Thank you so much.
Thank you. Namaste.